Hi, I'm Alex Spice. I'm the senior editor of Cure magazine. After 18 years as our magazine's editor-in-chief, Dr. Debu Tripathy has retired. We're incredibly grateful for his insight, guidance, and inspiration over all of that time. Recently, Dr. Tripathy and I sat down with Cure's new incoming editor-in-chief, Dr. Joshua K. Sabari. Dr. Sabari is an assistant professor in the Department of Medicine at NYU Grossman School of Medicine and the director of High Reliability Organization Initiatives at NYU Langone's Perlmutter Cancer Center. Dr. Tripathy and Dr. Sabari discuss their vision for cure, how cancer care has evolved over the years, and much more. And we hope you enjoy the conversation. Dr. Tripathy, how have you seen patient-centered cancer care not only evolve over the last 18 years, but also seen Cure's mission evolve alongside it?
Well, what I have seen over the last few years is that patients are becoming much more invested in their care, in understanding both the science and the clinical nature of therapies, and wanting to be more engaged in the decisions. I see that they are taking an interest in the scientific revolution, just as they have in many other big transformations that we've seen over the last few decades, the explosion in social media and digitalization. So people are essentially more engaged, and they also see that health is more of a concern that they can take direct control of. And also, the landscape has gotten more challenging in terms of how health is covered with HMOs and different carve outs. And so the whole field has made people understand that they have to be more in control and driving their care and their understanding of the care. And this has been a great mission now and becoming more complex for Cure Magazine and all of those who contribute to the advancements and putting them in a way that is understandable and digestible. So our mission really has become more involved and more important to patients with cancer and to all the other stakeholders that are involved, whether it's caregivers, a very important aspect of our patients' lives, and also the scientific revolution that is ongoing. So being there for part of it, being able to comment on it and put it into digestible and understandable ways for our patients has been a huge mission, and one that I, for one, am very grateful, and the whole team at Cure I know is adapting to the changes and responding, and will continue to do so. Things are still in transformation.
Dr. Sabari, what most excites you about joining the Cure team and working with Cure going forward to continue the work that Dr. Tripathi just detailed?
So first and foremost, have really large shoes to fill. Dr. Tripathy, you're a true legend in the breast cancer space, but also in, patient-centered medicine. As you were just mentioning, mentorship, the development of the next generation of oncologists, leaders in the field. I'm really excited to take the torch from you and to continue to work with you, to continue to build upon the educational motivation of Cure to really get patients engaged, to explain to patients their disease, to explain to family members, colleagues, friends, what they're going through. And I agree with you. In the era of social medicine and social media, I should say, there's really been an explosion of ideas directed by the patients. So patients now are at the center of their care. They own their care. And together with the advancements in science, technology, particularly, surgical technique, radiation and other local modalities of therapy, as well as systemic therapy and what we do, what I and you do on a day-to-day basis, patients are more and more involved in their decisions. So I look forward to carrying the torch that you've gracefully led for 18 years and also continuing to work forward together. And really, you're always welcome to join and look forward to continuing this project with you.
Thank you for those kind words. And also, I know that you will be every bit as effective as you have been in your professional life as being the editor in chief of Cure Magazine. I can see that you have the passion and really the mission that lies ahead is one that is going to grow in complexity. And I feel that our readers are such an important part of our community too. The feedback we get from them the interviews that some of them provide for us, and they give us the real world experience. Many times when I'm looking at the stories and the quotes that come from our patients, I'm learning so much about how they look at things and what their perspectives are and the ownership that they are taking, and also the way that they make important decisions. I and you and I counsel patients a lot, but we can't really get inside of what they're thinking and how they're making decisions. When they say it in their own words, it really educates me as to how to explain it better the next time. I learn so much from my patients, and I learn a lot from our Cure audience and from the interviews, and it gives me really a little more confidence when I discuss it, and actually even a little bit of a better understanding about the science of the medicine, of the medical changes and how it impacts our patients, how our patients are thinking and how they make decisions. And then it makes me better when I communicate it to my next patient as well. One thing I think that we're going to see in the future is the benefits that we're seeing from the technology revolution. I know that in breast cancer, the rate of drug approvals has gone up, and so has the complexity of the drug approvals. And we're now moving into a space where we are demanding more to know how to personalize therapy. That's going to be the next frontier, how we use genomics and proteomics and new technology, how artificial intelligence can be harnessed to help us with decision making. These are things that lie ahead. These are challenges and opportunities, and in the end, I think it's going to be better for our patients, and it's going to continue to improve things. So I look forward to these changes and to being a part of it.
You bring up a great point. I remember as a trainee over 10 years ago in the breast oncology clinic, thinking about how many different options there were for patients and different lines. And for me, as the fellow being complex, I can only imagine being in the patient's shoes and a family member's shoes. And I personally selected to go into medical oncology and thoracic oncology because it was much more simple. But now, as you know, there's been an explosion of targeted therapies, of immunotherapies, and really these are complex decisions that you and I have with patients on a day-to-day basis. I really hope to continue that conversation through the Cure magazine, through engaging our readers, our patients, our caregivers, our families, to continue these deep discussions to allow patients to make the best decisions for themselves and their families moving forward.
Yes, the patient voice is such an important part of the culture of cancer, and it's become so, I think, very exponentially in the last few years, and I think rightly so. The scientific field, the medical field, the governmental agencies that are involved alone cannot do this. The patient has to have a strong and solid voice, and it's not a voice in unison. There are certainly many opinions, many ideas, and that's healthy. That's a good ecosystem for us to have and to work with. So our part in communicating things to patients, putting it in perspective, and then hearing back from them and giving them a microphone to be able to eloquently state their feelings and decision making to the rest of the readership is really helpful. I find that the pieces that come out in Cure and the voices of the patients are really helpful for all the future individuals out there that are going to need this information and need to use it for their own path forward.
I couldn't agree more. And, Dr. Tripathy, asking for myself, what advice for me moving forward into this role that you've so eloquently led for the last 18 years? What do you charge me and with patients or readership moving forward into hopefully the coming 18 years?
Well, one thing that I have really enjoyed about my tenure as the editor-in-chief is that I have learned more about other cancers through Cure itself and through my patients. And of course, we do have to study for the board, so I do learn it that way. But as an example, lung cancer, really took the lead when the molecular revolution came around. It was one of the transformers, and boy, did it make a difference. Look at the statistics now in terms of how much better individuals with lung cancer are surviving, and it has really made a big difference. So, communicating all of this and having patients aware of their options and what lies behind it is so important. So, the one piece of advice is to make this understandable, be out in front of where the patient needs to be. I think that when a patient reads an issue of Cure magazine, let's say they've been recently diagnosed or they're moving on to a different line of therapy, I think that what we can provide them can complement what they're hearing from their care team. It is very involved and very sophisticated material that we are expecting them to know, but I know they're up for the challenge. And if they're able to read an article that coincides with what they have, or if they can even go back to back issues online or in print, I think it will help them ask the right questions and understand a little bit better what they're hearing from the physicians. So I think that that is an important thing to keep in mind. Again, this is a patient-driven effort we're living with and we're contributing to. And I think that those really are our guiding principles. I look at Cure Magazine sort of as the third rail, and to really help provide that information and perspective that is unique, that uniquely can come from this particular venue and the way we state it and communicate it.
Very powerful charge and powerful advice. And I hope to continue that, message. And, as you mentioned, patients reading this magazine are not only savvy, educated, but are asking phenomenal questions in the clinic. And one thing that I'd love to do and hope to do as a team moving forward is really democratizing the information and how our patients, our caregivers, our families consume this information. I know historically we had a paper magazine, and look forward in the future really to making this in more mobile, more video based, more content user friendly to all patients. So really all patients can have access to this extremely informative information. And one thing I want to ask you, Dr. Tripathy, is as the science changes very quickly. The therapeutic options change quickly. So there's tons of things to write about, to think about, to talk about. How did you select the important aspects, or how did you gauge what the readership wanted?
Well, I think about two things. One is what are new developments that may not be as well recognized and understood and might potentially help our patients. So that's very important. We want to be on the cutting edge and we want to talk about not only the therapeutics, but the diagnostics, the supportive care, quality of life aspects, the psychological aspects. We want to give them the latest and what resources are available to them. One of the big aims I have is demystifying. Think about it in the patient's shoes. They're coming in to hear about cancer and cancer treatments. All the technology is new to them. And there is a lot of mystique. They're hearing things from their neighbors and their friends and their colleagues. And demystifying and taking the unknown out of it really is what I aim for. I want the patient to read a piece and understand why does this cancer behave this way? What is it about the molecular biology? Why does this treatment work in the way it does? What are the side effects and how can they be managed? And what are some resources I can look up? So I think we want to make cancer seem like many of the other things they're dealing with in their life, house repairs and buying a car and looking at schools and colleges with your children. These are all things we're more familiar with, and cancer care and the science behind it should be just as accessible.
I agree, normalizing, but really you said it well, demystifying, making sure that people understand what's going on and sort of feel empowered to ask the right questions in the clinic and to help guide their care. Again, we mentioned how complex the cancer landscape has become, not just from a therapeutic standpoint, but you mentioned a payer standpoint, an advocacy standpoint. What are some of the roles that Cure has had in the past, and what can we do moving forward in those other realms, really outside of the clinic?
What I really like are the toolkits that we sometimes provide. What are resources you can go to? What are helpful things you can do to take care of some of the side effects? What's a good way to communicate this to friends that may feel uncomfortable talking about it? How do you make decisions for yourself? You're an individual. The way you might want to share this with your patients, how you might want to set up your clinic visits, that's up to you. We all have our rights to be who we are and to make decisions that reflect who we are. People should not feel that they are obligated to do this or that. And they should also feel very open to asking questions. I hope that we are, with what we write and share with our patients, that we're empowering them to advocate for themselves, to make sure they understand it right, to make sure they have the resources to go to and alternate points of views that they can find. We did a piece on second opinions one time and how valuable that is, but how sometimes it can be disturbing because you might get different opinions. We try to be as open and upfront as we can with our patients, opening doors, but not hiding what's behind them, and letting them be sort of in control of their own navigation, if you
Yeah,
will.
so I remember reading that piece on second opinions, and here in New York, it's not uncommon, and I'm sure in Texas, patients getting third opinions and fourth opinions. And I agree, a lot of people are worried about, making their team, their doctor upset, but really empowering patients to sort of hear what's out there, to learn about clinical trial options, how important those are in advancing the field, not only for yourself, but for people who may come before you or after you. So I remember reading that piece and how powerful it was to me, and I'm sure it touched many, many patients. So looking forward to taking the reins and to continuing to work together to drive Cure Magazine forward into, I guess, the next, hopefully many years.
And one thing that gets to be your voice is your editorial piece. I always have a fun time putting together what I'm going to say. You want it to be short and high impact, and it really gives you, you'll enjoy it. It gives you some leeway and some liberty to be yourself, yet at the same time help someone else out. I sometimes actually learn stuff by just what I'm writing and reading it again. I say, wow, I didn't realize this, but I read something and then I tried to put it into a format that would work for the editorial, and it really made me think about it and digest it more. So it's also a learning experience. It's been a wonderful journey for me, and I know it will be one for you. It'll add dimensions and depth to the way you think about things and how you speak about it and communicate it. And also just reading the pieces and the interviews that our wonderful staff is getting, and the information and the powerful words they're hearing from the patients. This is all a learning experience, and that's what it's all about. We're here to learn, to get better at it, and to really help our patients through science and humanity. Those are the two descriptors I use for the way we put together our pieces and our way of talking and reaching to our patients.
And Dr. Sabari, to help the Cure audience get to know you a little bit better as you begin your time here, I understand as an undergrad you were a philosophy major, which I find that incredibly fascinating. How does your background in philosophy inform your approach to oncology?
So not many people know that I was a philosophy major, but as a young man, and I hope I'm still young, but as a young man, I was very interested in decision making, and particularly the ethics around decision making, and that's what led me to majoring in philosophy. But it's been extremely helpful, both reading old literature, but also modern philosophy, and the ability to write and to succinctly sort of discuss arguments which has led me to medicine and the care of medicine. And Dr. Tripathi, I'm sure you agree with me here that our job as a clinician is to guide patients to make the decision that is best for them and their family. It's not black and white oncology, particularly not in 2025. There are many different regimens and options and treatment modalities. So really giving patients the information in a succinct way, but also giving them the information in a caring and thoughtful way so that they can make the best decision for themselves. So, no longer a philosopher. I wish I had the time to sit and think and write. Hopefully, being part of the Cure family will bring me back to that, sort of mindset. But really, my philosophy background has really allowed me to think about the patient as a sort of unique opportunity, a unique way to discuss the problem at hand, which is unfortunately cancer, and to go about it together as a team, helping make the best possible decision together.
Yes, I have been very impressed by the different backgrounds of my colleagues over the years. I myself was a chemical engineer, but I also took a lot of creative writing. I felt like that would help me express myself both scientifically as well as in other ways. And to this day, I'm glad that I have done that. I sometimes spend time writing really long notes about my patients only because I find that it helps me to get to know them. And so we all have different things that make us as good as we can be, and we strive to take good care of our patients and find different aspects of our background that help. So it's just wonderful to know that just as our patients, their caregivers have their own lives and their own ways of thinking of things, and I freely share that with my patients too. I feel like being myself and being honest and genuine is a great way to communicate. And I hope that my patients feel the same way. I feel that when they can share what's really going on in their minds, that I can actually help them out more.
Well, gentlemen, it has been a thrill to speak with both of you this afternoon. Dr. Tripathy, it has been a pleasure working with you during my time at Cure, and Dr. Sabari, I cannot wait to work with you. For both of you, I appreciate your time and your insight so very much, and I hope you both have a great day.
Well, thank you, Alex, for bringing us together. And Joshua, thank you so much for taking on the mission. I know you will do so well, and I'm looking forward to seeing this new direction for Cure, and so glad to be a part of it.
Thank you, and don't leave too fast because I'm sure I'll be inviting you for editorials, videos. So look forward to continuing to work together.
Absolutely. Thank you. Have a wonderful day, everybody.